So in this video, we will tell about the first year medical college student challenges. Okay, so we are creating lectures. Okay, our lecture will be provided in this channel. So subscribe the channel for lectures. And these tips is just for not complete. Okay, first year medical challenges. First of all is the overwhelming workload. What? For example, if you go to the college, there are many books and many syllabus to you. You have to call a lot of syllabus. You will be overwhelmed and you take your stress, but you have to adjust yourself with the stress and not take more stress. Why? It is so important for you that you have not to take more stress. Okay? And the other thing is the adjusting a regular and medical education. For example, you have intensity in Peace Medical School. For example, there is many challenges that medical education, peace, that intensity and tests, that you have to study a lot, develop effective habits. So for this purpose, you have to develop effective habit, seek guidance from the senior. Senior student can help you a lot, so you have to ask from them what book they call, what to read and what not to read. Another thing is time, challenges time management, balancing academics demand with the personal life. You can't manage the academics demand with the personal life because there are many syllabus. You have to fulfill that syllabus and also you have a personal life. So but that's why what is the strategy for that? Create a structured study schedule. If you want to challenge the time management, so you have to study schedule, prioritize tasks, incorporate breaks for the self-care. Learn to say no when necessary. For example, your friend tell you, let's go to a coffee, let's go to a coffee shop, let's go to the picnic. Again, for example, many times and that is just a waste of time. So you can say no. That's no is very important that you can say no in many situations. Another thing is the new learning style. For example, you are in the FSC second year, first year, before the medical college. You studied in different way, but when you go to the medical college, you have to change yourself, you have to adapt yourself. Okay, there is a transition from undergraduate to medical education. That is the problem solving. So for this purpose, you have to active learning technique. Active learning technique is very important. You have to follow this. This is in simple method. I tell you what is active learning technique. When you read the 2 pages, at the end of the page, you have to ask from yourself that what I read and what I remember, and then write that things in your paper. They become your flashcards. Okay. So for the learning style, you have to read. You have to increase your reading speed and increase the understanding, and not just complete things to remember. Just for example, if you read 2-3 pages, just write the summary in 5-6 lines. Okay, not too completely. And another thing is the cadaveric dissection. In many colleges there is a cadaveric dissection, but in many colleges this is not, because now our artificial models are convinced to use this and also use the app. So this is not a strategy for you. Developing clinical skills. For example, if you are in the first year, you have to know about the basics, for example, anatomy, physiology, biochem. But after that, when you go to the clinical department, many colleges also clinical skills in the first year. So if they are in the first year, so for that purpose, you have to attend clinical skill workshop, practice in the role-playing exercise, and seek opportunity for early patient interaction. For example, you go to the hospital, so you have to involve yourself with the nurses, with the doctors, with the patient, and that will help you a lot, because you have to become resemble, and you have easily can do any medical task, for example. Okay, can easily manage stress and anxiety. That is very common question of every student, of every medical student, because they take over stress, and in over stress they have to take over stress. That's why, because during over stress, what is doing? For example, if you take over stress, what's happened to that? So for this purpose, if you take over stress, some things become over stressed. Okay. So how it's happened? For example, there is a lot of syllabus to you, and that's you have to call a lot of syllabus. That's why it is too difficult for you to call a lot of syllabus in much less time. So first of all, you say that syllabus is not a lot and it's easy. Sometimes when you see a lot of books, you just shocked. How can I read this? How can I remember this all book? You have not to take stress, not to anxiety. Just relax, and for diminishing and for finishing this thing, you have to read every day. Everyday habit and everyday discipline to yourself to the study. So it's very easily everything become easy. Building effective study strategy. Effective study strategy. What is the effective study strategy? Effective study strategy means that study strategy that work best for you. What strategy best for you? Okay, I have already told about the active learning strategy. You have to utilize resources like flashcard. For example, after active learning style, you have to create flashcard and mnemonic device. Okay, and adapt your approach based on your learning style. What is your learning style? For example, in NLP, you have to read first of all see the image and then text, and this help other, and graph book is very important for that. And another thing is balancing social life. Many of the students ask that some students diminish social life, they just destroy their complete social life, they just study. It's not good, because you are a social human being. You are a social human being, you can't sacrifice your social being for the study. But you have to give more time to the study and less time to your social life. That's very beautiful things for you, okay, if you do like this. Another thing is growth mindset. You have to a growth mindset. For example, today you study some topics and you remember that topic, and the next day you have to grow your study routine, grow your knowledge, grow your everything. You have a mindset that I have to read, I have to work hard, that I change my today, that today I read this topic, 2 topics, tomorrow I will read 3 topics and I understand this. So you have a growth mindset just like a ladder, okay? You just like grow like this. Another thing is financial strain. So financial demand of tuition and living expenses. There are many financial issues to pupils and many students. They can't complete their demands and their fees, etc. So for those people, I tell them you have to explore scholarship opportunity, because there are many scholarship opportunity, and especially for the MBBS student who are in the government. For the MBBS student, there are many scholarship. Every scholarship program refer that if the MBBS student apply to any scholarship program, then the scholarship program give the scholarship to MBBS in the first way, in first priority. That's why you can explore scholarship opportunity for yourself, okay? And adapting to yourself to new environment. There are new environment when you go to a college, so you have to adapt yourself with that environment. This is everything I have told you now. Thanks for watching, and subscribe the channel and like the video. If you have any PDF, etc. needed in the description, click the link below and fill the form. Okay, we will talk in the next video. Thanks for watching.